let's talk a little bit about what is and are credentialing and provider enrollment. So credentialing is really a loaded term. Everybody utilizes that terminology very loosely. It's used to describe an awful lot of things. So for instance, provider enrollment, physician credential verifications, hospital privileges, primary source verification. Many people call credentialing, they utilize the term credentialing for many of these things. So let's talk a little bit about what it is and what it is not. So first of all, credentialing is not contracting, and technically credentialing is not provider enrollment. So for instance, Zetter HealthCare is a third-party vendor. We're a practice management consulting firm, and some of the work that we do is provider enrollment and working through payers as they conduct their credentialing and primary source verification. Credentialing is the process that insurance companies take in verifying and vetting a provider and all of their work experience and education. That is actually credentialing. The work that billing companies do, credentialing companies do, and things of that nature is actually not credentialing, unless, of course, you're conducting the primary source verification portion of the process. Billing companies, practice management firms, things like that actually conduct provider enrollment. We enroll providers with payers. The credentialing is actually done by the insurance company. If you are a hospital or health system and you work for one of those type of entities, then you are conducting privileging, which is also the process of conducting primary source verification. You're going out to taking a provider's CV, you're looking at all their employment, you're looking at all of their education, and you're basically going out and contacting those direct primary sources for verification in writing direct from them that the physician actually attended that residency program or attended that medical school, or that physician actually worked at that employer. That is primary source verification, and that is the process of credentialing, making sure all the credentials of that provider are accurate. So that is what credentialing is. It's actually that portion of it that is handled by either the insurance company or it's delegated to a health system or hospital in order for the hospital and health system that will take responsibility through NCQA guidelines, and they will conduct all that work so that the insurance company doesn't have to do it. So when an insurance company is dealing with a health system or hospital, they will delegate to that organization that job to do the primary source verification. Once that's done, then the health system or hospital puts together their provider directory, usually in some sort of a spreadsheet or some format that they've agreed to communicate to the likes of Blue Cross Blue Shield, Humana, Aetna, United HealthCare, and so on. And they will send a document, some type of electronic file, to the payer to communicate all the providers that they have verified and vetted and primary source. And all of those providers in that directory are then allowed to conduct work on behalf of the health system or hospital, and the health system and hospital will be paid for their services. Now, just one thing about delegated credentialing. If a provider, physician, let's say a physician works for the health system and obviously had privileges done, primary source verification, and they have what is called delegated credentialing completed. And a payer will communicate that to whoever is trying to get the provider enrolled with the payer. If they already have delegated credentialing, there is nothing that needs to be done other than attach or link that credentialing to the contract of which you are trying to link that provider once they are enrolled. That way, if you are a multi-physician practice or even a solo practice, as long as that provider is linked to that contract, their credentialing is, whether it's delegated or whether it's completed credentialing by the insurance company, then that NPI that's doing the billing on behalf of that provider will be paid for those services. So again, provider credentialing is the process of verifying the skills, training, licensing, qualifications of a provider. Provider enrollment is the process of enrolling a provider with insurance plans. You enroll with Medicare, you enroll with Medicaid, you enroll with all the commercial payers, and so on. Privileging is approving providers to perform specific procedures and granting them a specific set of privileges at your facility. And privileging is granting those privileges after you've completed that delegated credentialing process. Provider enrollment can be extremely time-consuming and a very duplicative process. And what I mean by that is that, first of all, every payer has their own rules. And as I always state, those who hold the gold get to make the rules. So every single insurance company out there, whether it's Medicare, whether it's a state Medicaid program, whether it's United HealthCare, whether it's Optum, whether it's Cigna, they get to make the rules on who they accept in their network, who they want in their network, and who they will credential and contract in their network. Normally, we communicate to our clients that the sooner we gather information on a provider or practitioner, the better off we are in trying to get credentialing and enrollment and contracts done in time for that provider to be able to conduct business and bill and be productive.